Spotlighting Hawaii's leaders.
We want to bring in Governor David E.
Good morning, Mr. Mayor.
Lieutenant Governor, good morning. Thanks so much for joining us. Mayor Derek Kawakami.
Thank you so much, Senator, for being here.
Spotlighting the issues.
Where is the virus right now in our community?
How much is this overall going to cost the state?
How are you responding to the community's concerns? Talk about the level of citations that you guys are writing.
Spotlight Hawaii with Yunji Denise and Ryan Kalei Suji on the digital platforms of the Honolulu Star-Advertiser.
This episode of Spotlight Hawaii is brought to you by Long's Drugs.
Happy Aloha Friday. Thanks so much for joining us here on Spotlight Hawaii. I'm Yunji Denise. Ryan has the day off today, but we have a very important conversation to bring you with a guest who has been on this program multiple times since we launched in 2020. Hard to believe that we've been on as long as we have, and having these conversations, a constant in all of these shows, has been Dr. Libby Char. She joins us now in her last time with us as Director of the Department of Health. Thank you so much for being here this morning.
Good morning. Thank you.
Well, we are noting, of course, with the Ige administration coming to an end, that a lot of the department heads are changing, and we'll be talking about your future plans for the end of the program. But let's get to the news, as we always do, and starting with COVID. When you look at the numbers and where the state is now, how do you feel that we're doing, especially as we head into the holidays?
I think we're in an okay place right now with regard to COVID in the state of Hawaii. It'd be nice to see the baseline a little lower, but we've at least been holding steady right about 150 new cases a day. We know the number is actually much higher because that only counts the tests that were administered, not the ones that are being done at home. But I think we're holding steady for now.
How much higher do we, you had said before that it was maybe 5 times as high. Do we know how much higher it is? Because you're right that most people, if you test positive on a rapid at home these days, you don't tend to get a PCR or report it in another way.
Yeah, it's really hard to say because I think as there are fewer, overall testing sites that are doing PCR or point of care antigen testing, more and more people are doing home tests, and they're so much more available and affordable these days. So I don't know what the actual number is, but I would imagine it's manyfold higher than the 160 we're seeing per day.
When we think about COVID and where we were a year ago, 2 years ago, obviously this virus, as it presents now, is very different, just in terms of the risk and the results that that seem to happen. But that said, when you read about what's happening internationally, there do sound like there are some pretty severe strains, especially when you look at what's happening in Europe and other places. What are you looking at when it comes to sort of projecting what is on the horizon for us when it comes to COVID and these new variants?
Well, I think one of the concerns is that the worldwide numbers seem to be fairly steady, but in Asia, we're seeing a significant uptick in cases, and that's particularly in Japan, China, and South Korea. So we really need to keep our eyes open. It's not over yet, as we keep saying. We'd like it to be. Singapore had a huge spike thought to be related to one of the subvariants, but they're on the way down now. And so far, what we've seen across the rest of Europe and the world, thankfully, it doesn't seem like there's a lot more virulence attached to these subvariants that we're seeing. In other words, the death rates and the hospital rates don't seem to be, skyrocketing from these new subvariants. Although we know that they are able to evade our immune defenses, our first-line defenses. And so I think that may have something to do with more people getting infected, but thankfully not translating into a lot more deaths or severe illness that requires hospitalization.
That said, we saw some numbers out yesterday. People are still dying in Hawaii from COVID. What are you seeing as sort of the common denominator for those people who do succumb to this disease?
Yeah, we mirror the rest of the nation in that regard. And it's typically older people, and especially those who are unvaccinated or who have not had a recent, booster shot. Maybe they got their primary series or they got one dose and they haven't kept up to date on vaccination. Significantly higher risk for death in those individuals. And that's one of the things we're really trying to push is, please, we have booster shots. We have shots available. It's free. Go get your booster shot. And especially if you haven't had a shot in the past, 6 months or more, absolutely go get your booster shot.
I mean, given that it is free and that's relatively easy, I got mine earlier this week, and you just go online to, whatever your pharmacy is,
Mhm.
you can schedule one and you're in and out of there in 5 minutes. Given that there are very few barriers, why do you think that the vaccination rate is so low? The last I read, I believe it was around 14%. You'll correct me if I'm wrong there, but why do you think that we haven't seen the uptake that we had in the past? People were lining up when this first came out outside the
Mhm.
Blaisdell, and now you can't give it away, it seems.
I think it's a couple of things. There was a Harvard study recently, and I think they said that 30% of the population wasn't even aware that there was, an updated booster shot, and another 30% had no idea who it was for. And so, really, that messaging piece is so important to say there's this new bivalent booster. It's an updated booster since September. It's out there. It's for everybody age 5 and older. Please go get it. It's a little bit more challenging to get your booster shot than it was when we did the very, very first round with the primary shots because, the federal funding is gone. And so we don't have large mass vaccination sites that are, scattered throughout the community. And so I think it takes a little bit more intention on the part of all of us to make an appointment and go and get it. That being said, I mean, there are well over 100 places statewide that you can go get your vaccine. It's quick, it's easy, it's free. This Saturday, Queens is doing a vaccination for the public. I think it's at Palama Settlement. Hawaii Pacific Health is doing something at Kapiolani this weekend for booster shots. Kaiser has been a good partner all the way through offering vaccination, even for non-members. And then local pharmacies, community partners, especially Healthy Mothers, Healthy Babies, they have been vaccinating and even offering for people that needed more assistance. I don't know if they still have it, but they had been going to people's residents and helping them vaccinate. So it's out there in the community, it's available, and just really want people to do it. I mean, especially before we travel and especially before we gather for the holidays. It's a present to yourself. It's a present to your family members. Go get your shot. And by the way, you can get your flu shot at the same time.
Well, let's talk about some of those factors that are out there in addition to COVID. You mentioned the flu there, and ahead of this broadcast, I've gotten a bunch of messages from moms who say, please ask her about RSV. What can you tell us about flu season and also RSV? Because we're hearing, nationwide about this huge outbreak of RSV and how much it does impact young children.
Yeah, so it's interesting. RSV, or respiratory syncytial virus, influenza, and COVID are all respiratory viruses. Typically, there's kind of a seasonality to RSV and flu. And it's cold and flu season is usually about December, January is when it peaks. And nationwide and in Hawaii as well, we've seen a big bump in October and November, which is unusual. It's really early this year. RSV affects children more than it affects adults in terms of the negative effects. We're concerned because hospitals have been very, very full in Hawaii. Lots of more kids are being hospitalized for RSV than in prior seasons. You can get vaccinated for flu, you can get vaccinated for COVID, but there's no vaccine yet for RSV. I know they're working on it, but there's no vaccine yet. And in most of us, adults can get it, but you've been exposed to it from the time you were a baby. And so, it may manifest as the common cold in adults, and in most people, even, teenagers and older kids. But for the little kids, their airways are so small, and some of them haven't been exposed to it before. And so oftentimes it's the little kids that are getting much sicker and needing hospitalization.
What are you concerned about? I mean, given that, you did mention the holiday gatherings, we're all getting together. That includes young children, and, all of us together. What are you concerned about if the hospitals are where they are right now with the pediatric patients? What are your expectations or your concerns, after Thanksgiving and then as we head into Christmas?
Yeah, and that's a really good point because the hospitals are already full. Thankfully, in Hawaii, we still have capacity, and the hospitals are taking care of everybody that needs care. But certainly, we're seeing the numbers bump up a bit, and so we don't want this giant influx of sick people. It's the same story for COVID. All the same things work, And so above and beyond getting your booster shot and getting your flu shot, if you're sick, stay home. Nobody else wants what you have. If you're around someone and they're sick and coughing and not looking well, create some distance there because you don't want to get sick from them. Masks work terrifically well. So if we're going to be indoors and there's large crowds, wear your mask. Better yet, take the party outside. If you can, do it at Auntie's house on the lanai, that's safer for everybody. So it's those same messages as years past for COVID. And I think that's why the numbers were so low for flu and for RSV over the past couple of years with COVID, because we were employing all those measures. And so it kept us safe from all of these respiratory illnesses.
Now, with RSV, what is the treatment when these children are ending up in the hospital because they have that impacted breathing? What can be done for them? Is there medication, or is it, do we just have to ride it out?
Yeah, so there's no specific treatment for RSV like there would be for, certain bacterial illnesses. So it's mostly what we call symptomatic treatment. And so, when you get a cold, if you have a fever, you take some kind of anti-fever medicine like a Tylenol or an ibuprofen or something. And just making sure people are staying well hydrated and getting a lot of rest. In the little kids, when they end up in the hospital, sometimes it has to do with breathing problems. And so they may need support for breathing, up to and including, being on a ventilator and certain anti-inflammatory medicines. But for most of us, RSV will make you sick, but it's just like riding out a cold as you would any other cold.
Okay, I want to bring in a question here from Heidi. She says, will hospitals be getting additional staff? Nurses working double shifts is unsustainable. We saw Hilton Rathel speak recently about just how many people are now in the are hospitalized in Hawaii post-COVID, and that there's sort of a new benchmark, a new normal, if you will, that just we have a lot more people in the hospital than we ever have. And it's not necessarily COVID related. You did mention that the hospitals still have capacity, but we do rely on a number of traveling nurses and other medical professionals. What are your concerns, as we head into the holiday season? We are expecting, of course, more passing around of germs and viruses, about our hospital capabilities.
I think that's an ongoing issue and has to do with workforce and workforce development. The hospitals right now are still utilizing some travelers from the mainland that come to work in Hawaii and augment the workforce here. And I know that there is an emergency order in place right now, I think it's an emergency order that allows nurses from the mainland who are licensed to come practice in Hawaii without first obtaining a Hawaii license, as long as they're in good standing. And so I think they're looking to extend that a bit more as well, while DCCA is trying to work on some solutions to get people, credentialed and whatnot. So I think it's an emergency rule, admin rules. And so they're probably looking to extend that. And we're looking on our end, there's been some legislation and some funding to help with the training aspect and with hiring people who can help in the educational realm to educate more clinicians to stay in Hawaii and work. And it's not just nurses. I mean, it just spans all of healthcare and the allied healthcare fields, as well as, other professions are having a hard time recruiting workers.
Let's talk a little bit about the holiday practices. I always like to ask you what your own protocols are, because I think it informs the rest of us. I used to always ask you, are you going to restaurants yet? I know you're super busy, so the answer is always no. But surely you'll be taking a little bit of time to be with friends and family for the holidays. How do you best approach this? Because it does feel like for so many of us, you go out and I don't see that many masks anymore as I used to. We personally were traveling to the mainland for Thanksgiving. We'll be masking on the plane. Chances are most others will not. So how do you navigate these, and what are sort of the own systems that you have in your family as we head into this time where some people still think that COVID's a risk and other diseases are a risk, and others clearly do not?
Yeah, and I think that's the answer. Is it's sort of looking at the risk. So we don't want to live in fear, but we also want to be reasonable. So it really is, how many at-risk people am I going to be with? And if the elders in the family are at risk from health, then we need to be extra careful around them. And we need to make sure that they're protected and that they're vaccinated and boosted and, in good health. Family Thanksgiving this year will be at a relative's house, and it will be on the lanai. Thankfully they have sort of a covered lanai, so that's going to be safer for everybody. And then if anybody's sick or think you don't feel right, or you have a little bit of, the sniffles or a little cough or something, then people have been really good about staying home so that we don't expose, aunties and uncles to germs. And then just being cognizant, I think, and when it's crowded or when we're indoors or something, we wear masks. And I think it's reasonable when we're sitting out on the lanai, we don't wear our masks and we all have a good time and socialize with each other. So it really is just finding that balance between the risk and the benefit.
I want to bring in this question from Jay. It says, is the vaccine shot considered to be a good thing annually like the flu shot now? And if so, I've heard things about the COVID vaccine costing an absurd amount of money down the line. Do you know anything about the cost for us down the line with the COVID vaccine? Obviously, this is a question that perhaps is more suited to someone like Senator Schatz, who's pushing for congressional funding. But, given that it's free in the moment, it seems like now is a good time to get one. And do you expect that this is something that we're going to have to take every 6 to 12 months? What's your expectation for how this becomes part of our vaccine regimen, if you will?
So the White House was saying that they expect that this will turn into something kind of like a flu shot, where it's an annual booster to catch whatever the variants are circulating at that time. I think this is a great reason to get your booster shot now. We don't know what's going to happen. At some point, the vaccine will become commercially available, and the government will stop supplying it. But for now, it's free for everybody. If you're 5 and older, go get your booster shot. If you haven't had your primary series yet, go get your primary series and then get your booster shot. But I think it'll probably become an annual thing. And, I would hope that with flu shots and everything else that the insurance would help cover it, or somehow make it so that it is feasible for everybody to get their annual shot, if that's what it turns into.
Part of the sort of just the things that I've heard around town when you talk to people is, well, I already had COVID. I don't need to get the booster. So many people did get COVID in recent months. It just seemed like every time you talk to someone else they know was sick or had been sick and had recovered. And so they feel like they have some natural immunity. Can you tell us about sort of how you make that calculus in terms of when you should get the booster and if you should get it if you had COVID recently?
So if you had a recent infection, then you should wait at least 3 months before you get the booster shot. It's still worth getting that booster shot. The data that's coming back now from use of the booster shot and comparing it against various populations, like those who had COVID, those who had primary infections, those who were infected a long time ago, those who had 2 shots but not boosters. The booster shot that we have now in the U.S. is showing like 5 to 6 times more antibody protection for the neutralizing antibodies. So it's worth getting. The other thing that's really interesting that I think should be tremendously impactful is that they're finding that with this booster shot, it minimizes your chances of getting long COVID. Mm-hmm. And to me, that's so significant, because most people don't think about long COVID until you get it or somebody that has it, and it can be life-changing for them. So if you can prevent ever getting COVID or ever getting long COVID, that's huge. If you said it was just a cold and you just ride it out, okay, so be it. But if you have long COVID and it's going to impact you, for the rest of your life, or maybe change what activities you can do, I don't think anybody wants that.
Yeah, absolutely. We've had Dr. Dominic Chow, who runs the long COVID clinic, on here before, and the outcomes that he is describing for some of those patients, it really is life-changing for them, and potentially, for the rest of their lives, or at least for a number of years. So that is a good point. I want to bring in Karen's question here. She says, is there a test for RSV? We know we can do a rapid test at home for COVID. What about RSV?
So there is a test for RSV. I think the message here, though, is that we don't need to rush out and get it. if children end up in the hospital, they're sick enough, the little ones that they actually need to be hospitalized, oftentimes they will test to find out exactly what they're dealing with. But for the rest of us, there's really no need to get it. And especially for adults that are healthy, if you have cold symptoms and you're sick and you have a fever and some aches and you're staying home, it really doesn't make a difference because you're not going to be able to do anything differently anyway. And you don't need to get that test. You're going to treat it symptomatically. You're going to stay home while you're sick. You're going to cover, when you're coughing or sneezing. You're going to wear a mask if anybody else is around. So adults should not be looking to get this test if they're normal, healthy people. Same for the older children. If they're normal, healthy kids, they don't need to do it. The medical providers can tell you when you need to get a test, and it's primarily for the younger children if they're really sick, or especially the kids that end up in the hospital.
And those kids that are ending up in the hospital, when we talk about kids, obviously that's a broad range, anyone under 18, but you're talking about the real little ones. What's the age group that is the most vulnerable to RSV?
I think it's the youngest kids, certainly under 5. I'd have to ask the pediatricians, to really pinpoint that age, but it's the younger kids that are under 5. And, typically by the time you're about 2 years old, you've been exposed to RSV. You've probably had an infection or two. But what we're seeing, especially related to everybody having been spread out and wearing masks and whatnot, that the rates of flu and RSV were really low in the past few years. And so I think maybe some of the kids that normally would have been exposed have not been exposed yet. That may be a factor in playing into some of this.
I want to ask you about your personal plans. We know that you took over the helm of Department of Health under the request of Governor David Ige. He, of course, his administration's coming to the close on December 5th. Tell us about what your plans are. Are you going to be sticking around, or are you going to be moving on to something else?
Yeah, I think I'm really tired. I'm going to take a little time off and probably sleep for a couple of weeks. And then thereafter, I'll take a look around. I think it's time for somebody else to come into the department and to take over and start, some of the rebuilding and whatnot. Sorry about that.
That's okay.
But,
I know you're busy.
Yeah, I'm not looking to stay at all. It's time for somebody else to put some energy in.
Well, let's reflect back on just, when you came in. Of course, we were in a very, very difficult time when it came to COVID, a lot of mistrust in terms of what was happening at your agency, and just, a lot of public concern, and people were really freaked out, if you will, about COVID. When you reflect back on just your tenure in that job, how do you look at that time, and what are you most proud of during those last few years?
I think it was a really challenging time because there was so much that we didn't know. We didn't know if this was something that was going to go away after a month, or if it was how badly it was going to impact Hawaii. And so just dealing with a lot of the unknowns made it pretty scary for a lot of folks, and made it hard to really figure out how best to deal with it. I think what I'm most proud of is that there are an awful lot of people here in the Department of Health and across the state that have been working really, really hard. And there were folks here, into the wee hours of the morning working on data every single night. We felt the results of the cuts from the budget cuts back in 2008, 2009. And the public health system, and especially DOH, really took some huge hits. And so all of a sudden when COVID hits, and we hadn't rebuilt, we felt those cuts. And so we're trying now to kind of support and rebuild public health. And I think the legislature would be wise to really invest in public health. It's challenging because when public health is going well and things are going well, we're invisible. You don't really think about the fact that you're going to turn on your faucet and get clean water out of there. You don't think about the fact that we have standards for clean air and for safe drinking water and for, vaccination in schools and all the other things that we have in play that keep us healthy. And I think, that we as a state did a really good job. I think we did a good job with vaccination, and it has to do a lot with the community. It's not just us, it's our entire community. And I think in Hawaii, we really still have that sense of, it's not just myself, it's for my family, it's for my community. You do things for others. And I think that held us in really good stead through COVID because people were willing to pitch in and pull together.
but I do want to acknowledge that you personally, came under a lot of fire. You had protesters outside of your house. Just what has this all been like personally? You go from being an emergency room physician and someone who's, helping to manage, emergency response, and that's your background, to taking this very public role. Suddenly everyone knows your name. They're looking up where you live and trying, and you're working all these hours. My understanding is that you only took a week off in the entirety of your time working there. So no wonder you want to take a few weeks off to sleep. I mean, what was this like for you on a personal level? Because it did become quite personal at some points.
Yeah, I think, I think the thing that probably motivated the most was just a sense of purpose and a mission. And then having so many people in this department and trying to be a good role model and pull the department together, and actually to pull the community together, to say we need to go in this direction. We can deal with this. We can get through this, but we all need to pitch in. And so I think because it was such a visible role, that was really stressful for me. I don't usually like being in front of cameras, but I really felt a sense of purpose, and somebody needed to be in this position and be pushing and pulling. And so I kind of felt like that's what I needed to do. I look forward to not being so visible and being able to wander through Costco and not be noticed.
I think people are still going to come say hi, but I do want to know what's your best advice, to the person who takes the reins from you. What would you hope that they learn from your experience, and what would you tell them?
I think the advice would be that, it's been a really rough couple of years. It's been a rough several years. We need to really support and rebuild public health. We need to rebuild those bridges and get those relationships that we've created now between, the community partners and the healthcare sector. And we need to really foster those and make sure that we keep those really strong, so that when the next thing hits, we have those relationships in place. We have the community already geared, with links to and from the department, and we are one community. Really, we need to invest in public health now, and we need to really enhance the framework, take the lessons that we learned from COVID and put them to good use. If we just kind of sit back and say, "Phew, glad that's done," and take a break and move on, then we'll be unprepared for the next thing. So I think really take those lessons to heart, invest in public health, rebuild, strengthen it. We're going to need funding from the legislature. We're going to need, people to work. There are so many people in the community to get off the sidelines, come and help. A lot of people, I think, are interested, and it doesn't mean that you have to work in state government. That's an option. We've got a ton of openings across state government. Come work in state government. There's some really good benefits here. You can be a part of something bigger, but there are other ways that you can pitch in as well. But just get off the sidelines and help. Try and help. Do what you can. It can be something big. It can be something small. Go volunteer somewhere. Help a nonprofit. Whatever. Help your neighbors. But pitch in. We need a lot of help, and we need to do it as a community.
Yeah, I love that call to action. We're almost out of time, so I just want to give you an opportunity for a final word in your final appearance on this program. And again, thank you so much for coming on so many times over the last few years. We really do appreciate it. We asked you so many questions, and you were always willing to come on and to be very forthcoming. So we really appreciate it. So just a final word for our audience today.
Yeah, I appreciate, the role of the media and what you and Ryan have done to help get the word out and to get, credible, reliable information out to people and different perspectives. Really, I'd like to give a big shout out to the staff for going above and beyond these past few years. I have learned so much about so much from my team here at the Department of Health. And just, there are a lot of people working really hard day in and day out. So my hat's off to them. Kudos to them.
Okay, Dr. Libby Char, thank you so much for joining us this morning, and please do enjoy your last few weeks on the job and then those few weeks of sleep. We hope to see you in the community and check in with you again soon. Thank you so much.
Thank you.
Always wonderful to hear from Dr. Libby Char, the Director of Health. Of course, she did say that when Governor Ige sunsets on and a new administration is brought in on December 5th, that will be her last day as well. She says she is looking forward to some well-deserved rest. In her whole tenure as the Director of the Department of Health, she took off just 1 week for a family wedding, and no other time. She worked long hours to try to keep all of us safe. She made some decisions that some in the community didn't like and took heat for that, but of course, stayed steadfast throughout and really always constant and consistent with her messaging. Get vaccinated, socially distance, wear a mask, stay home if you're sick. We've heard that time and time again because she was just so committed to trying to help protect the community. You did hear her there, talking about what should happen in the future to her agency and really pushing the legislature to fully fund Department of Health, saying that the cuts that were made back in 2007, 2008 really hindered the department a decade later, or a little more than a decade later, when COVID came to be. And we really felt the effects. Sometimes you don't see what is coming until you're faced with a crisis. You heard her say there that public health is something that the public doesn't really think about and shouldn't think about when things are going well. But when things are not going well, that's when you really see any weaknesses there. And of course, as we look back at the COVID response, we do see how, having a really strong health department is so, so important. If you missed any part of this program, of course, you can go back and watch from the beginning. She spoke about COVID numbers in our community, seeing about 150 cases a day, but she estimates that those cases are far, far greater because so many people are doing home tests. She talked about the importance of getting a flu shot right now because they are seeing an uptick in flu, and of course, RSV affecting the youngest children in our community. Kapiolani Medical Center, has said in the past that they are seeing quite a few children coming through their doors with trouble breathing and whatnot. And Dr. Char saying all of these diseases really are seeing a rise because we did listen to those warnings and did keep our distance and did mask for the last 2 years. And now that we're all back together and mingling and having gatherings again, we are seeing an uptick in these viruses. So please be careful out there. She did warn folks for the holidays. Of course, we're going to gather, and that is part of the fun and the celebration toward the end of the year. But advising folks, if you can gather outside, go to the lanai instead of going inside. Be cognizant of those that you're around. Make sure that if there's someone sick in your family, that you stay home. And if you see someone else who's sick at a gathering that you happen to be at, make sure that you maintain your distance as well. And of course, encouraging folks to get the vaccine. That bivalent booster is out there. If you haven't gotten a shot in about 6 months, it is time to get out there and get one. You can schedule one at your local pharmacy. Very easy. It's free. And one really interesting thing that she noted was that it has 5 times the efficacy in preventing future illness as opposed to just having had the virus. That those studies are showing that having the booster is much more effective than having had previous infection. So if you think that you're immune because you had COVID already, maybe think again, talk to your doctor about when it's appropriate for you to get that vaccine. We always love having Dr. Char on. We wish her the best of luck in whatever comes next to her for her, and we will be watching. She did take the helm of that agency at a very difficult time and led the state when we really needed it. So we appreciate her. On Monday, we'll be talking with Rick Blangiardi. The mayor always has lots to say, and we have lots of questions for him. Ryan will be back. Until then, have a safe weekend, and we'll see you right back here on Monday at 10:30 for another edition of Spotlight Hawaii. Mahalo.
This episode of Spotlight Hawaii is brought to you by Long's Drugs.